Thank you, Billy. First of all, those of you who don't know about where we are sitting right now, before you leave, find out. Pastor Joe is somewhere around here, out in the hallway, but this is a unique place. This any church you've ever been to. It's what's known as open and affirming. Anybody that walks through that door is welcome. We have people here from all races, all ethnic backgrounds, sexual preference, whatever. Doesn't matter. It's a open and affirming environment. Creates a unique place. This speaker series is a great opportunity. The older I get, the more I realize that we can't solve any problems around the world, and we can't solve any problems in our own community, and we can't solve any problems within our own home without education. And the fact that a lot of us are retired is no reason that we can't learn. Learning is a lifelong process. I just happen to have obscure facts rolling through my brain that many people don't really understand. I try to take every opportunity I can to educate folks on a number of things. Let me give you just a quick background. Sue and I, my wife Sue is back there in the gray shirt. Sue and I owned a long-term care business for 25 years, assisted living community, skilled nursing home. I'm a retired lawyer. Sue is extraordinarily involved in the community. She does like a zillion things. I probably do a half a zillion things, but one of the things that I am involved in, I'm the villages president of the villages chapter of the National Retiree Legislative Network, which is a nonprofit, nonpartisan organization that has representatives in Washington, D.C. that advocate for issues that impact retirees. And we're going to talk about some of those issues today. But I would encourage, and I've got a couple sign-up sheets that I would love to have you sign. If you're interested, your name, please print, and your email address. There's a newsletter from the NRLN that keeps people on top of legislative changes. Many of us here are retired. We cannot take our eye off the ball. We cannot, and you'll hear me talk about some of the issues today. We have to know what's going on in the area of Medicare, long-term care, prescription drugs. There are a lot of issues that impact every single one of us, and a lot of these issues are going to work its way through the legislative process in Washington, D.C. We have to be advocates for it. I'm willing to speak to any group about these topics. I do a fair amount of public speaking, but education, we have to educate ourselves, educate others, and stay on top of legislative changes. So I'll circulate these sign-up sheets. If you're interested, please sign your name, email address, please print. I have a hard time reading, and we'll get you on the newsletter mailing list. But let's, I've given you a handout that covers a lot of different things. I talk about, and normally when I speak in public, it's like at a Rotary meeting. You got 20 minutes and a hook comes out and they drag you off the stage. That's how it works, and I'm really good at, if you tell me 20 minutes, I told you earlier I'm a bit obsessive compulsive, I am, but if you tell me 20 minutes, that's where we're at. Today is a real luxury for me because we've got a fair amount of time. We're here to talk about things that are on my mind, but if this is really going to be a productive session, we need to get into a dialogue. If you've got general questions, ask them. If you've got specific questions about your specific situation, I talk to individuals every day of the week. Every day of the week, I tell folks, I don't know the answers to all the questions. I know a lot of the questions. And the issues that we're dealing with, it is so important to know what questions to ask. There are authoritative answers out there that you can find, but you've got to know what questions to ask. So let's run through some issues here. The primary thrust of what I want to talk about today is Medicare and some long-term care issues. But if you look at my list, I've got some disjointed facts that some of which you've never heard of, but I want to make passing references in the next hour to these issues so that you're aware of some of these issues. You can follow up with me, you can talk to me, and we'll get further information. But let's start, before we get into talking about Medicare, let me run through the laundry list. I'm a retired lawyer. I don't give my legal opinion to anybody about anything. You know, I always like to start out that conversation. As a retired lawyer, you don't offer your legal opinion, particularly when you're a Michigan lawyer and not a Florida lawyer. So I don't offer legal advice to anybody. But there's some legal things you need to really, really be aware of. You need to understand what medical directives are. You need to understand what a durable power of attorney is, and you need to talk to your lawyer about a will and/or a trust. But those documents, and I can tell you, back in a former lifetime, I used to draft these documents. I didn't do a lot of this type of work, but I did some of it. And you come to Florida, and they must have had every train wreck imaginable down here, because the medical directives and the durable power of attorney is like something from outer space. They're completely different. You need to have a Florida lawyer. You need to have somebody that understands Florida law drafting these documents. Are they important? Darn well they're important. They're extremely important. And I'm going to talk to you in a minute what you do with these documents once you draft them. But you can't go the week. If you don't have updated copies of these documents, the first thing you do when you get home is call a lawyer, a Florida lawyer, and get these documents done. If you had them done up north, that might be a good starting point, but still, you need to have them reviewed and probably updated to comply with Florida law. You don't understand what a set of medical directives is. And Sue and I both had the opportunity to hold these documents. It was terror in our hearts to hold these documents in our hands 5 o'clock one afternoon a number of years ago as we're making life and death decisions about our daughter, okay? And fortunately, she was an adult, and fortunately, we had updated documents, and we were holding those documents in our hands. You know, you're in shock, you don't know what to do, but she's an adult. And you're just a person on the street. You know, yes, you're their parent, but you don't have the legal right to make life and death decisions for that person when you're talking about an adult child. Get the documents done, and make sure, and I'll talk to you about in a minute, you've got to know where those documents are. And let me kind of launch into that discussion. I tell everybody, you need to organize your life, and you need to do it in a 6-inch thick 3-ring binder with 50 index tabs. And the obsessive compulsive person I am, I give you the draft, a table of contents of what should be in that binder. If you go to my blog, and you'll see my blog on that handout that I gave you, if you go to my blog, you can download a file called Plan for Life Checklist. It contains 30 pages of some of the craziest things that your mind could ever comprehend. Unfortunately, they're all really, really important. But some of them you haven't heard of. Most of them I'll touch on briefly today. Organize literally your life in that 3-ring binder. What do you do with that 3-ring binder? You go to Amazon and you purchase a fireproof safe, and you put the 3-ring binder in that fireproof safe. You share the combination to that with your partner, with your children, with anybody that needs to know. And if you have a safe deposit box at the bank, what you do is you go to the bank, you take everything out of that safety deposit box, and you close it. The worst place in the world to put these documents or anything of any I joke, unless you're laundering money, have a lot of diamonds and jewels and stuff like that. But if we're talking about legal documents and important insurance policies, those kinds of things, they do not belong in a safe deposit box. Who's going to steal them out of your home? Like, oh, this is a cool insurance policy. I'll steal it. Nobody's going to steal those documents. First of all, they're in a fireproof safe. But secondly, if you need them now, and you don't need to go and figure out how to get them out of a bank. And God forbid somebody passed away, you may not be able to get them out of the bank. You may need a court order to get them out of that bank. Close the safety deposit box, buy a fireproof safe from Amazon for $250, talk real nice to the Amazon driver when he comes to your house, and see if he will deliver it to your office. And it'll save you, yeah, they're a little heavy. But download my Plan for Life checklist off of my, pardon me, let me kill this thing. My iWatch. I'm going to tell you before the day is out why everyone in this room needs to go out and buy one, but give me a few minutes before I get into that conversation. Some of you have heard it. Medical directives, durable power of attorneys, will and trust, do it. You don't have any choice, you must do it. Question. Medical directive is the same as a living will. It's giving, yeah, it's a living will. It's synonymous with living will. Durable power of attorney gives the person that holds that a power of attorney the ability to sign that person's name, even if that person is unable to act on it. They're unconscious. They're in a coma. A person holding a durable power of attorney can sign that person's name. A normal power of attorney terminates with a disability. A durable power of attorney survives that disability. It terminates upon death. But the disability, the coma, doesn't terminate that durable power of attorney. When I drafted these documents in a previous lifetime, I'd get the husband and wife, in the room, and I'd say, now look, I don't know how to be tactful about this, but I hope you love each other, because you're about to sign a durable power of attorney, and it's a very powerful document. You can do anything, if you hold that document, you can do anything that that person could do themselves in terms of signing their name. But it's critical, and it's critical. It's medical directives and a durable power of attorney. It's the original that count. Don't talk to me about copies. Copies don't count. You need to know where the original is, and that original needs to be in that 6-inch thick 3-ring binder, and you're safe. Because when you need it right now. Let's talk about one of my favorite topics. It's a topic that I talk about. Yes. Yeah, that's that's a challenge. You need to. I guess I would travel with the documents because if you need those documents, you really need them right now. That for snowbirds, that's an issue. But just remember, the originals are what count. Billy.
We do that, and rather than carry the big notebook, we carry a zip drive.
Oh, yeah.
It's this big, so you don't have to carry them back. You don't have to carry the whole notebook back and forth.
The dilemma is that with regard to, am I having trouble with?
No, you're fine.
Oh, yeah, that would be good. Okay. The dilemma is if there was a crisis, the original is what people are going to look at. The original durable power of attorney, the original medical directives. But let's talk about my favorite topic. It's a topic that the National Retiree Legislative Network is extraordinarily involved in. It's Medicare. The NRLN is constantly advocating for issues that impact Medicare. But the challenge that I see is that people don't understand how the system works. Let me try to give you a very brief tutorial on how the Medicare system works. And I've done a lot of public speaking, and I don't like PowerPoint because it always breaks, so I use my hands. It's my PowerPoint. But when you turn 65, you got two pathways you can go down. When you turn 65, everyone is eligible for Medicare Part A. Part A covers hospitalization and those costs. And Medicare Part B, we all pay for Medicare Part B. It comes out of our Security. And Medicare Part B covers doctor's visits, outpatient stuff, radiology, those kinds of things. But if all you had was Medicare Part A and Part B, you'd subject yourself to very large potential copays and deductibles that could run into the thousands, the tens of thousands of dollars. So people fill those gaps under Medicare Part B, A and B, in one of two ways. They either acquire a Medicare Advantage plan to fill those gaps, or they acquire a Medicare supplement. They're two distinctive tracks. An Advantage plan is a for-profit corporation that has been hired, commissioned by Medicare to provide services to you. And they're usually for-profit corporations, are paid a fee to take care of all of your health care. On the other hand, a Medicare supplement, you're dealing directly with I joke all the time, and it's really not a joke. If you've got an Advantage plan, do you really have Medicare? Well, kind of, but not really. If you've got a Medicare supplement, you in your doc codes something for you need an MRI. The doc codes it. You bill Medicare directly. There's no intermediary. There's no for-profit company in the mix. So which pathway should I go down? I tell folks that if you're looking at any Medicare policy, there's three questions that you've got to ask. I'm going to repeat these three questions a couple of times because they're really important. Question number one, what's the premium, the monthly premium for the policy you're looking at? Question number two, what are the maximum copays and deductibles that you could incur in any 1 year? Okay? And question number three, what are the rules on the use of hospitals and doctors? What are the rules on the use of hospitals and doctors? In my opinion, question number three is the most important. Let me repeat those three questions. They're very, very important. What's the monthly premium for the policy, regardless of the policy, whether it's an Advantage plan or a Medicare supplement? What's the monthly premium? Question number two, what are the maximum copays and deductibles that you could incur in any 1 year? And question number three, which in my opinion is the most important, what are the rules on the use of hospitals and doctors? So let me give a couple hypotheticals. Let's say that the Cadillac, in my opinion, the Cadillac Medicare policy on the market today is a Medicare supplement G like in George plan and a separate drug card. It used to be the F plan. As of January 1st, 2020, you can no longer get the F plan. If you're on it, you're grandfathered. And if you've got it, keep it. You've got the best. Do not, well, there is a minor technical, you can't, and I'll explain to you in a minute, you can't move. You cannot, as a matter of right, move from one supplement to another. If you've got the F plan, you've got the Cadillac, you're grandfathered, keep it. If you're new to Medicare, the Medicare G plan is the Cadillac. So let me answer my three questions with a hypothetical G plan. You're 65 years of age, you're eligible for a G plan. A G plan from Humana may be $25 more or less than United Healthcare or more or less than Omaha Insurance Company. The prices may vary slightly, but a G plan is a G plan. They're all the same. Here's how it works. Let's say you pay a hypothetical premium of $175 a month for the G plan, another $25 a month for a drug card. So your total cost is $200 a month. So my first question for the G plan, what's your monthly premium? $200. What are your maximum copays and deductibles under Medicare Part A and Part B if you've got a G plan? The answer is $200. You pay the first $200 of expenses that you incur, which you will incur those expenses on your first doctor's visit in January. And after that, you have zero copays and deductibles. Okay? So question number two, what's the maximum copay and deductible with a G plan? The answer is $200. Question number three, what are the rules on the use of hospitals and doctors? And the answer is there aren't any. You can go to any Medicare doc, any Medicare hospital that accepts Medicare, and I can tell you they all do. If I tell folks, when you're looking at whatever plan you're looking at, apply the Mayo Clinic rule or the Mayo Clinic test, or if you prefer the Cleveland Clinic test, or maybe the Shands test, or the Moffitt test, or the MD Anderson test. Any of the big-time healthcare providers in this country, can you get to that plan? Can you get to those facilities with the Medicare plan that you have? If you've got a G plan, a Medicare Supplement G plan, and you want to go to Mayo Clinic, you don't need a referral. You pick up the telephone, you call Mayo Clinic, you schedule an appointment. When you get there, once you've met your $200 deductible, once you get there, zero copays, nothing, zero. You can access the best healthcare in the United States. So let's apply my 3 questions to a hypothetical Medicare Advantage plan HMO. A Medicare Advantage plan come in 2 varieties. They come in HMOs and they come in PPOs. Let me talk about the one I like least, a Medicare HMO. First question, in your zip code, you can likely purchase a Medicare supplement, HMO, and a drug card for $0 above everybody's going to pay for Medicare Part B, regardless of your plan. But above the cost of Medicare Part B, you can get an HMO, a Medicare HMO, for $0 in premiums in most zip codes. So the answer to my first question is 0. My second question, what's the maximum copay and deductible that you could incur in any one year? Every single HMO, every single PPO is going to be different, and it's going to change every single year. So you've got to look at your policy every year and make sure that G plans doesn't change. It doesn't change. That HMO and the PPO, the Advantage plans change every single year. So you got to look at it. But let's say for purposes of, and in 2024, the maximum that can be charged, there's a hard cap. I think the hard cap is like $7,500 for 2024 a year. So let's assume, for the sake of our discussion right now, that your hard cap for that HMO is $5,000. Okay? So you got a 0 premium, and in my example, you got a hard cap of $5,000. That's question number 2. Question number 3, what are the rules on the use of hospital and doctors? Here's where it gets tricky. Every single policy, every single HMO, every single PPO has a different set of rules on the use of hospitals and doctors. If you've got an HMO, I can tell you there are going to be an extraordinarily narrow group of doctors and hospitals that you can go to. There's going to be a fixed radius on where you can go to. You got to have a referral to get to those doctors. It can be a very, very heart-wrenching situation if you want to go to any of the specialized care facilities that are offered here in the United States. A PPO, on the other hand, permits you to go out of network and pay a higher copay and deductible. There are some decent PPOs out there, but you still need a referral, you still have a network to deal with, but there is an escape clause in most PPOs that permits you to go out of network. So in my 2 examples, which is more expensive? The HMO that costs $0 in premiums, or the G plan that costs $200 a month? Which is cheaper? Well, I would argue that the G plan is cheaper, because the G plan has no copays and deductibles, and in my example, that HMO had a $5,000 hard cap. So is $2,400 less than a $5,000 hard cap on expenses? People will always come up to me and say, but I'm healthy. To which I say, congratulations. But what's going to happen today or tomorrow or the next day? And in terms of managing your expenses, would you prefer to pay $200 a month or subject yourself to whatever on that hard cap? Here's the dilemma that you can tell that the nice thing about the role that I play in the community is that I can offer my opinion. And I can offer my unvarnished opinion, and I always recommend that, challenge my opinion. Educate yourself, and if another policy, Medicare policy works for you, that's great. If you want the HMO and the 0, that's great. But please, please, don't let Joe Namath sell you a Medicare supplement. Please. Don't buy your Medicare, one of the most important decisions that you make. Please don't buy it off a television ad. Please don't worry about the free silver sneakers health club policy. I tell folks, but they say, well, I get my silver sneakers, and I say, so what? So what? If you want a health club membership, go buy it. Go buy it. Do you want the health club membership, or do you want the access to Mayo Clinic? You've got to make that kind of analysis when you make this important decision. I speak regularly to groups like this, but I speak as a volunteer to law firms, to financial planning groups, I love the lawyers. I love the lawyers. I've had 2 or 3, I had one here in the Villages, where I speak to a law firm about Medicare. And I love to tell the lawyers, particularly if they're estate planning lawyers, that the decision that you make for Medicare is one of the most important financial planning and estate planning decisions that you can make. And these really smart estate planning, they're staring daggers at me. I knew this guy was crazy. And I pause, and I don't say anything. And once I end my pause, I say, now look, if estate planning has something to do about getting money from one generation to another, and if financial planning has something to do about managing cash flow, then the decision that you make for Medicare is a financial planning and estate planning decision. And then they breathe, and they realize that I haven't lost my mind. But it is. It's all about how you're going to manage your expenses during retirement, and how you're going to manage access to health care during retirement. So choose wisely. Here is a fact. I get people tell this all the time. Well, I'm going to get that I'm healthy. I'm going to get that zero premium HMO. And at that point in time in my life where I need health care, I'll switch to that Medicare G plan, which I heard is so great. Got news for you. Can't do it. At 65, which is your election period, you make an election on which track you're going to go down, the Advantage Care track or the Medicare supplement. After a 1 year, you've got a 1 year window to change your mind. And if during that 1 year window you decide, I don't like that silver sneakers, I'm not using it, you could give up that Advantage plan and pick up that Medicare supplement. After that 1 year window closes, you've made an irrevocable decision. You can't go from the Advantage track to the Medicare supplement track as a matter of right. You can apply, you can be turned down, and you can be rated at a high premium, but you cannot do it as a matter of right. Seriously? People don't know that. And people will often say, well, I'll switch if I have, and then they get the cancer diagnosis and they realize they can't go to Moffitt because it's not in their network and they can't switch. And I can tell you, although you could apply and the company can rate you or turn you down, if you've got a serious diagnosis, guess what their answer is going to be when you try to enroll in a Medicare supplement? It's going to be no. And you're going to be stuck in that Advantage plan forever. Now, don't panic. A lot of people say, oh, great, I'm 73 years old, and you just told me what I should have done at age 65, and you just told me that I made an irrevocable decision, so what do I do? That question I hear often. My answer is don't panic. The HMOs I don't like HMOs. They're very narrow in scope. If you're in an HMO, you're in open enrollment right now, look at PPOs. Look at moving from one Advantage plan to another. Look at a PPO rather than an HMO. There's a premium attached to the PPOs, but they do permit you to go out of network if you want to. The thing, I told you, you make an irrevocable decision. So you selected that Advantage plan at age 65. At 70, you want to change. You can't. But let's say you selected the G plan at 65, and at 70, you say to yourself, that silver sneakers thing, I'd really like to give up my G plan and get that Medicare HMO. You can do that. You can go from the Medicare supplement track to the Advantage track one time, but you can't go the other way. It's a one-way street. So if you're going to make the wrong decision at age 65, which wrong decision would you want to make? Would you want to get into the supplement track and 3 or 4 or 5 years later change and get into the Advantage track? Or would you want to select the Advantage track, realize 3 or 4 years you made a mistake, and be blocked from getting that Medicare supplement because you've got a major pre-existing condition? That's the dilemma. If you've got the Advantage plan, please don't panic. Look at, during open enrollment, look at opportunities to move to a PPO. How do you get advice to decide which plan is right for you? I often, there's always insurance agents in the audience when I'm talking, so I try to be a little less harsh than I normally am. But I often say that the worst people to get advice from on Medicare are insurance agents. They are, and that's a little harsh, and I apologize. There are some very educated insurance agents. If an insurance agent can't explain to you what I just explained to you, you might want to think twice. If they can't tell you the advantages and disadvantages of an Advantage plan and a Medicare supplement, maybe you're talking to the wrong person. If they can, and they can tell you the differences, you're talking to the right person. But make sure that you make an educated decision. Where do you go if you want objective advice? There's a group called SHINE, S-H-I-N-E. I've got the 800 number that I can give you. I've got it written down. I'll give it to you before we leave. But it's a group called SHINE. It's a group of educated volunteers who have no horse in the race. They will provide clear, objective advice on all the plans and all the options that are available to you. They won't be as blunt as I am. I have the luxury of being able to express my opinion. And when you talk to SHINE, they're going to say, well, this is what this does, and this is what this does. They're not going to give you the unabashed opinion that I can give you as someone who, I don't represent anybody. I'm not working for anybody. I'm a volunteer. The opinions that are expressed here are my opinions. The good news is my opinion is backed up by an awful lot of people. There was a great article in the Wall Street Journal last week that discussed these issues and expressed my exact sentiment. But educate yourself, Sue.
How does Mayo Clinic in Florida feel about
Mayo Clinic, that's that second-rate healthcare organization called Mayo Clinic. 2,500 of the finest physicians in the world working at Mayo Clinic, including Jacksonville, sent out a letter to Advantage plan holders a little over a year ago that said if you've got an Advantage plan and you're in Florida, yeah, you really don't want to come and see us. This is Mayo Clinic. If you look, I read a recent study, a comparison that looked at the top healthcare facilities in the United States. Mayo Clinic, 1, Shands, 2. And anybody's poll, Shands is right in there, whether it's 1 and 2. But if you want world-class healthcare, we have it within 1 hour of the villages. We've got it over in Jacksonville, 3 hours away.
In state. John Hopkins, if you're on the Medicare supplement plan, you could go out of state.
Yes, absolutely. Yeah, sure. You go to John Hopkins with that G plan. You can go anywhere in the United States. You can go to Anderson in Houston, the cancer center. But you've got Moffitt sitting right here in Tampa, which has got a national reputation for being an outstanding facility. Those are things to think about. And can you get to Moffitt if you've got a PPO? Yeah, look at the PPO, which you probably can. You'll pay a higher copay and deductible if you go out of network, but at least you've got access to world-class care without getting a referral. The problem with Advantage plans, number one, the problem with Advantage plans, and the National Retiree Legislative Network gets crazy over this, as do I, it's really an effort. It used to be about 75% of people in this country had Medicare supplements. 25% had Advantage plans. It's now up to 50-50. Half are in Advantage plans, half are in supplements. What's going on here? We're privatizing Medicare. We are privatizing Medicare. Look at the money that's being spent on advertising to advertise Advantage plans. We're trying to convince people to give up their Cadillac Medicare G plans and to acquire these Advantage plans where we've layered over the whole, Advantage plans are 4, 5, 6% higher per enrollee than Medicare supplements, which amounts to about $50 billion a year to taxpayers. Why are they higher? Well, you've got this for-profit, not all for-profit, but many of them are for-profit organizations that administer these plans. The costs are higher for Advantage plans versus a Medicare supplement. Does that make it bad? No, there are good Advantage plans out there. But as an individual Medicare enrollee, you have to decide how important my third question is to you. How important is it to you that you can make your own you and your partner can make health care decisions without the need of a referral? Without asking your doc says, you need to have an MRI. And your Advantage plan administrator says, Jim, I think we could maybe put Jim's MRI off for 6 months. It's not that critical, is it? And, is that the kind of conversation you want to have with the Advantage plan? Or if you've got a Medicare G plan and your doctor says, you need an MRI, Jim, he codes it with a Medicare code for an MRI, you get that MRI done here in a few days, it's done and over. I talked to a lot of your primary care docs love Advantage plans because they're part of the program. They're part of the program. On the other hand, most of the specialists I deal with kind of know my background, and I get into these heated conversations with them, and they jump a foot or so off their table, displaying their dislike for Advantage plans. A great example, and I don't normally talk about personal situations, but this one's pretty good. I had a urologist that did an MRI of my prostate, and he came back and had something suspicious, and he told me there's a 50% chance that it's cancer. He said, but I could go in and biopsy it right now, and he told me there's a 15% chance that I'd miss it, that I'd come back negative, and it's really positive. He said, but what I can do is I'll do a second MRI and create a 3D image of the prostate and go in with 3D imaging equipment, and I won't miss it. I will nail it right on. And fortunately for me, they did that, and it came back, and everything was negative. But when I'm talking to him after the procedures are all over, and as he's elevated about a foot off his chair, he's explaining to me how it would have worked had I had an Advantage plan, which I knew how it would work, but it was great to hear him tell me how it would work. He said we'd have done the first MRI, it probably would have gotten approved. He said I wouldn't have gotten approval for the second MRI, and I would have biopsied that, and I might have gotten a negative biopsy, and there's a 15% chance it could have been positive. Well, it's 15%, that's not huge, unless it's you. Unless it's you. I mean, that's one simple example of I didn't need a referral to get multiple MRIs done. All I needed was my doc saying this is medically necessary. It hits a Medicare code. I didn't pay a penny for I'm sure it was a very expensive process to do 2 MRIs and a 3D biopsy. Simple example. Take that example and take it into more complex medical situations, and you can imagine how what you've got to go through if you have to deal with referrals. But again, if you're in an Advantage plan, don't panic, don't walk out of here depressed, but you're living in an open enrollment period right now. Talk to your insurance agent about, if you're in an HMO, talk to your agent about moving from an HMO to a PPO. At least then you've got my third question. What's the rules on the use of hospitals and doctors? Those rules will loosen once you move to the PPO. And there's some good PPOs out there. They won't be premium free. You'll be paying a premium that will, I suspect, come maybe not all the way up to what a G plan is, but you'll pay a decent premium for that PPO. But some of them are real good plans. Are there questions on this topic? This is really, really an important topic. Yes, please.
So when I go to sign up for Medicare 265, and I want to check into the G plan,
Great question. The question, let me repeat it because I know we're recording the presentation here. The question was, when you turn 65, what do you do? Well, a couple things. Most people auto-enroll in Medicare Part A and Part B. You get your red, white, and blue card automatically. If for some reason a month or 6 weeks before your 65th birthday, if you don't get that card, you want to call Social Security and make sure that you get enrolled in Medicare Part A and Part B. Everybody does it. Everybody pays the 100 and whatever it is, 60 bucks a month for Medicare Part B. Get over it. Everybody pays it, okay? How do you enroll for that Advantage plan or supplement? What I tell folks is, if you have an insurance agent, use them. Use them. You're not going to pay more. You can go to Medicare.gov, and you can search prices by zip code for Advantage plans and Medicare supplements. It used to be, and we advocated very hard, the NRLN advocated very hard that they publish prices for supplements. Years and years and years went by where all they gave you was 800 numbers for Medicare supplements. You go to the Advantage plans, they tell you all the pricing. You go to the Medicare supplements, they wouldn't tell you the pricing. You had to call. As of in the last year, finally there is pricing for Medicare supplements on Medicare.gov, okay? You can do it right online. You can enroll with Humana or United Healthcare or any of the companies right online. You can do it yourself. I'd suggest you do your research, go online, check out prices. If you've got an agent, use an agent. It doesn't cost you any more, and if there is a problem, you've got somebody that can be your intermediary to solve the problem. We've had G plans now for a number of years. I went to my agent that we did all our business work with for 25 years, and I said, hey, can you write a Medicare G plan with Omaha Insurance Company? And she says, no, we can't. And I said, I'm not licensed with that company. And I said, well, if I gave you 2 weeks, could you get licensed? And she said, yeah, I guess I could. You would do that? I said, yes, I would. And I waited 2 weeks and had her enroll us in our Medicare G plan. I could have done it online. I knew more about it than she did. But now I've got an agent that if I had a problem, could resolve the problem for me, and I don't have to lose sleep over it. It's been a number of years now. I've never had the opportunity to have to call to resolve a problem because I haven't had any problems. You know those complicated bills? Let me digress here. Medical bills, $1 zillion on each page, but down on the bottom it says you owe. And if you're on a Medicare Advantage G plan, it's still $1 gazillion, but that number, that you owe number, is 0. If you've got a Medicare Advantage plan, the $1 gazillion is there, and there's a number down at the bottom that you owe, and it's more than 0. So now the question is, was there an error up here in that billing, and is that $500 bill accurate or not? I don't know. I can't read. I'm not smart enough to read a medical bill. But you need to know that you're not overpaying for that on that UO number. A G plan, that UO number is 0. You know, after you pay your $200, it's 0. So the billing is it's great on G plan. I had one occasion in the last few years where I owed $47.18 was the UO number, and I looked at it and I said, that's not right, and called the doctor's office and said, that's not right. And of course, it wasn't right. But you know that there's a problem if there's a number that you owe at the bottom of that bill. Yeah.
So far you talked about Plan A.
Plan A. Yep.
Not Plan B.
What's Plan A?
Plan A is hospital, Plan B is...
Plan A, Medicare Part A are your hospital expenses. Medicare Part B are your outpatient doctor expenses. Those we all get. What I've been talking about is the supplement that you're going to get to fill in the gaps around Medicare Part A and Part B. So if all you had was A and B, you'd subject yourself to potentially huge copays and deductibles. Yes. 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 Now, it does not cover Medicare Part D. And let me get into an explanation here of Medicare Part D. Part D is your drug coverage, okay? Everybody's going to have copays for drugs. Every year, if you've got a Medicare supplement, you want to go and check to make sure you can't get a better deal on your drug card. during open enrollment, which we're in right now. Look at it. If all you're taking is generic drugs, get the cheapest drug card you can get. My drug card costs $14 a month, and but I'll look at it. I'm now on a fairly expensive drug, so I'll need to look at it during open enrollment and see if there's a better deal out there. And you can change your drug card without impacting your Medicare F or G plan, whatever supplement you've got. You, yeah, yeah, that's true. And yeah, and I'll talk about GoodRx here in a second, but you must have that card, that drug card. If you don't, you'll be penalized down the road if you ever sign up for it. So you must have the drug card. And look at it every year, because the cost of your drugs is the premium cost plus your out-of-pocket costs. And it's a great thing on Medicare.gov. When you go in, you actually put your drugs in, you select the pharmacy you're using, and it will estimate what your premium cost and what your out-of-pocket costs are for that for those drugs at Walgreens or CVS or wherever you. So you can rank it. You know, maybe it's better to pay $50 a month for a drug card rather than $10 a month because the deductible is lower. So you got to look at the whole picture. But the Medicare.gov, the drug finder, is a wonderful tool to help you figure out what's the cheapest drug. So what do? You must, as I said, you must have a drug card, but you've got to look at a couple other options. GoodRx is I don't know how they do it, but everybody has got to look at GoodRx. If you've got an iPhone or a smartphone, download the app onto your iPhone, and when you get a drug, your Walgreens will bill it at your insurance card amount, but you got to go into Walgreens when you pick up that prescription with a GoodRx coupon open on your iPhone and see if it's cheaper. And I cannot believe it, but in 25% of the time, it's cheaper with GoodRx. And you know, Sue takes a drug, one of the diabetic drugs, it's called GoodRx Gold. You pay $10 a month premium for it, but it cuts the cost of those diabetic drugs by, what is it, $65 a month we save by paying that $10 GoodRx Gold. There's another very interesting, I recently got, because of an AFib situation, I'm on Eliquis, and my cardiologist didn't know what drug card I have. When he wrote the prescription, he says, you know, this is a really expensive drug, which it is, it's $500-600 a month. He hands me the prescription, and he gives me a business card and directions on how to get to the Canadian pharmacy here in the Villages. And so I, you know, doing the due diligence that I always do, I go to, I knew what my drug card would pay. I knew what GoodRx would pay. I go to Canadian pharmacy. The drug costs, what, $500-600 a month. You can get it from Canadian pharmacy for $225 for 3 months supply. Okay, and my drug card was $40 a month with my drug card. So my drug card was the cheapest. But you got to compare it. And I walked into the Canadian pharmacy and I told her, you know, my doc, my cardio, oh yeah, he sends a lot of people over here. I had a friend who he's a nationally known physician. I won't say a name, but he's a nationally known retired physician, big reputation. He calls me and he says, Jim, you know, my wife is taking this drug. It's cost $200,000 a year for this drug. His out-of-pocket was pushing $20,000, and he said. So I walked through the whole analysis, and I said, Doc, have you checked out you know, Canadian pharmacy? And he said, this guy's like really in the know, right? He says, what's Canadian pharmacy? And so I said, look, I drive by there all the time when I go to the health club I work out at. Send me a picture of the bottle, and I'll go in and find out. They kind of known me by first name at Canadian Pharmacy because I'm going in there, and he can save about $6,000-7,000 a year buying that very sophisticated drug out of Canada. Well, that's a big deal. That's a huge deal. So don't blow off Canadian Pharmacy. Don't blow off GoodRx, or in selective cases, GoodRx Gold, and absolutely you have to have a drug card. Yeah, well, I don't ask, you know, that might be, yeah, that's crazy. One of the things the National Retiree Legislative Network has gone crazy over, Medicare represents 60 million people, all right? That's a couple people. And today, it is illegal for Medicare to negotiate drug prices with the pharmaceutical companies. That's the law today, okay? Are you kidding me? Wait a minute, Mr. Pfizer. I represent 60 million people. What do you sell this drug for? Oh, I'll buy, you know, a trainload full of it. What's the price? You can't get into that negotiations today. Under the Inflation Reduction Act, which was passed here in the last year, insulin, which is one big deal for people that are on it, if you're on Medicare, if you're retired on Medicare, insulin is capped at $35 a month right now, today. Effective January 1st of 2025, your total out-of-pocket costs, if you're on Medicare, are capped at $2,000 a year. That's a huge deal. Our daughter takes one drug, one multiple sclerosis drug that costs $100,000 a year. And she is on Medicare. Her drug costs will be capped at $2,000. That's a huge deal. And effective January 1st, 2024, coming right up, Medicare can start negotiating. It's initially a set of 10 drugs. That list of drugs will scale up over the next few years, but initially, the first year, Medicare can start negotiating for 10 drugs. Number one on that list of 10 is Eliquis. And what will the price be for Eliquis? Nobody knows, right? It's negotiations. But Medicare can now go to whoever makes Eliquis and say, you know, that's 60 million people. I mean, what kind of price can we get? But that conversation today is illegal. But the law is changing. The National Retiree Legislative Network and every advocacy group for retirees has been advocating for changes to reduce the cost of prescription drugs. People shouldn't have to make a choice between food and drugs if they're living on a limited income. People shouldn't have to, and your point is, why should we have to go to, why should our cardiologist have to give us a business card from Canadian Pharmacy to fill an Eliquis prescription? Excuse me? What am I missing here? So the National Retiree Legislative Network has been advocating for these issues. It's great, and that there is progress being made. Do we still need to address some of the cost of prescription drugs? We sure do. And yeah, question.
You said start of 2024, the cap is $2,000?
25. Yes. Yeah. Yes. Any out-of-pocket costs for a Medicare recipient starting 1/1/25 is capped at $2,000. Well, the expenses are going to, yes, I mean, the expenses are going to have to run through somewhere where you can track those expenses. I suppose you'd run them all through, I hadn't thought of that, but I would think if you ran them all through your drug card, you're going to be able to document, if you're buying drugs out of Canada, you may not be able to document that you hit the cap for $2,000. If they all run through your drug card, you're going to document that hard cap through your Medicare drug card. Yeah, administratively, that's probably how you'll have to do it. It's total out-of-pocket copays. Yes, copays. Question?
Just a question. I too am on Eliquis.
Yes.
It's a gambling game. And I found that I go to Farm Store, which is a Canadian pharmacy.
Okay.
The drugs are made in Turkey by Bristol Myers, same company. They're shipped from Moritaria to me. And it was $150 for 90 days. Last time I applied, they couldn't get them from Moritaria, so they went to Australia. Price was increased to $250 for 90 days. So it's amazing. Around the world, you find a lot different prices.
What you need to do is go to the Medicare.gov, to the drug finder, and put in all the drugs you're taking, and find a drug card a Medicare drug card, and my Medicare drug card is $40 a month, and for Eliquist. But we're in open enrollment, so you can move from one to another. But yeah, talk to me offline here, and I can.
But you can't change that Plan D anytime during the year. It's fixed
It's
right now during the enrollment.
in open enrollment. You can make the changes right now during open enrollment on a drug.
So like if, after enrollment and
Yeah.
like say you need to be on this.
Yeah, you're stuck. You're stuck for 9 months, 10, whatever. Let's talk about a number of issues, and I'll talk some of these fairly quickly, but things I want you to know about. Long-term care. Sue and I owned a long-term care business for 25 years. We've been down here almost 9 years. Long-term care, everybody's talking about medical insurance and the cost of medical insurance and the cost of drugs. And as you can imagine, as we've just talked about here the last time, it's a big, very important conversation. Nobody is talking about the cost of long-term care. And I'm a huge advocate of long-term care insurance. I'm a huge advocate for it, provided that is what makes everybody cringe. Provided that you purchased the policy 20 to 25 years ago from one of a handful of companies that were bright enough 25 years ago to properly underwrite it, that are still in business today, that didn't go bankrupt because they didn't. The policies that you would buy today look more like whole life insurance policies. They're kind of a hybrid policy. The policies that Sue and I've had now for, goodness, 25 years. Once the benefit starts, it goes on forever. The policies that you would buy today have a finite defined, maybe it's a couple years, maybe it's capped at a couple $100,000 total out-of-pocket expense for the insurance company. They're finite number of dollars. These open-ended policies that go on forever aren't on the market today. You had to buy them 20, 25 years ago. If you've got a long-term care policy, look at it. If you want somebody to look over your shoulder, let me know. I'll give you my candid opinion on it. But don't give that policy up until you've really thought it through. And one of the problems the insurance industry has had is when they start writing these policies 25 years ago, they figured, well, like every life insurance policy or whatever, people will buy it and they'll give it up and we'll win because we'll take all those premiums and we don't have to pay off anything because they terminated the policy. People realized when they got long-term care insurance, it was a great investment and they didn't give it up. And the whole actuarial thing got crazy, I think, for some of these insurance companies. But a policy that has been in place for 25 years, like ours, are not cheap. They're not cheap. But the cost to stay in a skilled nursing home today, 10 grand a month, 12 grand a month, 120,000 a year. Assisted living is going to be a few $1,000s a month less than that. But we're still talking about a very large expense. And I've always said long-term care insurance is nothing but a financial planning decision. Cash works really well if you've got big bucketfuls of it. And long-term care, the expense to long-term care isn't that you need a skilled nursing home for 2 years. That's not the risk of long-term care. The risk of long-term care is you're 65, you're 70, you're whatever, and you need skilled nursing for 10, 15, or 20 years. That's your multi-million-dollar risk. 100 grand a year, 125,000 a year for 10 years, do the math. You're talking about $1 million. And the policies that you would have available today aren't available to cover that $1 million. They're going to be short-term, finite policies. So long-term care is a big deal. Think about it. What I tell folks is long-term care starts at home. Most people would prefer to have a few hours a week of home health care, have a spouse that might be the caregiver, but in the wisdom of all these homes that are built here in the villages, they put 4-inch steps everywhere. They put 32, 33-inch doors everywhere. And long-term care starts at home. Look at ways. If you go to my blog, you can download the design specifications, including photographs. The house that you see in there is our home. We bought a home that was 20 years old. We ripped it apart, put it back together again, and it's all zero step. You get rid of all those 4-inch steps. There's a way to engineer them away. You don't even know they were there. It doesn't look like a handicapped house. A skilled carpenter with a Sawzall can get rid of those 33-inch doorways in a heartbeat and drop in a 36-inch door. The real horrible thing, garden tubs are awesome for orthopedic physicians because people break hips, they break bones, they hurt themselves really bad, and sometimes they die because they fall in bathrooms. If you got a garden tub, here's the best thing you could do with it. After you rip it out, you get the carpenter in and you cut there's 4 inches of concrete in all of our floors, right? You cut that concrete right down to the sand. Get rid of that entire 4 inches of concrete below that garden tub or that step up or step down. I love the step down showers. Those are really handy. Get rid of those. You cut the concrete right down to the sand and you replace that 4 inches of concrete with 2 inches of concrete. And you turn the last 2 inches over to the tile guy and let the tile guy finish that last 2 inches so everything flows right to the drain. No doors needed. Everything flows to the drain. Don't you dare. If you go down south, I love it. They have what they call Roman showers. Well, they got the floor plan right. But then they put an L-shaped 32, 33-inch entrance into that Roman shower. It's like, what are we thinking here? You need at least 36 inches. Preferably, ours I think is like 42-inch entrance. You don't need a door on a shower. We have a really nice piece of etched glass that covers part of it. It's not needed. It's not doing anything. It looks nice. But there's still an unobstructed 42-inch access to that shower. Showers are critical. You got to get in the front door. You got to get in the bedroom door with a 36-inch entrance, and you've got to get into the shower. And while you're at it, get rid of all your 32-inch doors. Garage doors are pretty easy. That 4-inch step, get rid of that baby in a minute. Cut some concrete, re-pour the concrete, 4 inches is gone. Those 4-inch steps, I was sitting next to a lady one time, I didn't know her, she starts talking to me. Her husband had just died. Anybody got a 4-inch step in their lanai? Oh yeah. He tripped over that her husband tripped over that 4-inch step, hit his head and died. So, yeah, 4-inch steps, how big a deal is that? Well, it could be a very big deal. And you can get rid of them with engineering. The dilemma that you face is that there isn't a builder alive that knows how to do it. Seriously, maybe that's a little overstated. But the guy that we used, I'm on my hands and knees telling him how the floor should look, and he's been building houses forever. He said, Jim, are you sure that's what I should do? Yep, I'm sure, Rodney, that's what you should do. And he said, okay, I'll do it that way. And it came out perfect. But if I hadn't been on my hands and knees on the floor explaining how you were going to cut that concrete down to the sand, we're going to pour 2 inches of concrete in there, had he poured 4 inches of concrete in there and then turned it over to the tile guy, you know what would have happened? All the water would flow to the door of the bathroom. Yeah, we have put Rodney into the building shower business because seriously, there's not a lot of builders that understand how to do it. The builders, you can't get rid of that 4-inch door. You need that 4 inches at your front door to keep water from coming into your house. I had a builder build a house all his life. You can't get rid of that 4 inches. Water will flow into your house. And I looked at him and I said, seriously? Did I drop the elevation of the house down into the ground 4 inches? No, that 4 inches is still there. You just can't see it. But it's that kind of mindset that makes it really hard to convince people that a zero-step design house is doable. They make custom designer grab bars that look awesome, rubber-backed, easy. Sue? Yes. Sue is the brains of our business. Is my lovely wife. She ran the day-to-day operations of our assisted living facility.
You can see what our pillow talk is like. That's scary. I go to sleep really fast.
That's really, really mean-spirited.
So, long-term care, from my perspective as an administrator of a facility, I did a lot of touring with kids whose parents lived in Florida, and I have to say it was only after we moved to Florida that I really understood the seniors or the elder parents' anxiety of leaving Florida. So I'll say I did learn a lot of sensitivity to that after the person moved in. But I suggest that you go to visit the very first time any facility close to mealtime, because you can see the people coming out of their rooms, going to the dining room, and you can kind of see, is there any kibitzing going on? Is there some dynamic? Or is it just like everybody's moving to the dining room? That gives you a sense of what the atmosphere might be like there. It also, visually, you can see who mom would be living with or who you might be living with. Is everybody in a wheelchair and walker? If they're not able to visit with each other, or are there people who seem to be like you? The second time you go to visit, well, the first time, be sure you leave with a calendar of their activities. And the second time you go to visit, go at a time that there's an activity scheduled, because many times those activities never happen. Staff person didn't show up, they didn't go around and beg everyone to come out to an activity. In our facility, I always said, if you have to go knock on doors to get people out to that activity, then it's a dead activity. Let's move on to another idea where they will want to come out. And then when you're making the move, always finances is involved, and you want to make the financial decision that will be the lowest risk of having to move again. And so sometimes I would have families that wanted to move mom in because they really liked what we had going on and blah, blah, blah. And I would say, but your mom really could only live here, from what you're telling me, about 1 year or 18 months. And how difficult it will be to tell her you have to move because you've run out of money. In the meantime, she's made friends and all of that. If a person is having dementia, they need to be in a memory care unit. If they move into a facility that really doesn't, it's rare to have a facility that has zero dementia going on, but if they move into a facility that you like aesthetically and you like everything that's going on, and there's not really much memory care, they will be shunned. It's just a human nature. They don't know that person. Now, if the person lives there a few years, then they've made friends there. As they develop the dementia, actually, they'll look out for each other. So I always share the example of my aunt. I wanted her to come to our place and live. She had very little means, but we were going to figure that out. But we were in Michigan, and she lived in Illinois, where her family was. She didn't have children, but her siblings were all in northern Illinois. And the facility chosen for her was not a facility I would have even considered for any of my aunts and uncles, but that's where she landed. And her siblings, especially my mom and dad, would make sure that they visited. My mom said, how can I advocate for her? And I said, find the staff who are always there and make friends with them. Which leads me to the other important question you want to ask during a tour. How many staff do you have? Oh, we have a 125-bed facility, and we have 125 employees. Does that include administration, laundry, housekeeping, activities, everybody, or is that caregivers? You want to know how many caregivers they have. And how many of your caregivers have been here 2 years or longer? They're never prepared for that question. That was something I liked to bring up right away because it was something I was really proud of with our facility, that we maintained a longevity in our staff. It means mom won't have to, or you won't have to say, these are my idiosyncrasies. And tomorrow a new person comes in, these are my idiosyncrasies. And next week when a new person comes in, you say, just do what you're gonna do because I'm tired of telling about my idiosyncrasies. Seriously, you'll pull back. So if they don't know how many caregivers exactly, and if they definitely don't know how many have been there over 2 years, then it's not something they celebrate. And that is a big red flag. But if your only choice is a place you're really not happy with, be sure it's geographically close to your advocates so that they can stop in going to grocery store or stop in on the way to church, or that it's not a journey for them.
Yes.
Talking about advocates, do you recommend that families enlist the help of a healthcare advocate? Should that be part of our plan, Jim, with everything?
If you have a family member who's already willing and you're happy with that healthcare advocacy set up, you don't need another person. In our case, we've listed all of our kids really to be able to step in should something happen to one of the kids, the next kid's up.
I know we've all heard stories about how things have fallen through the cracks because the patient was not really aware of what was happening or just went along with
Yeah,
what they were told.
if the person living in the facility does not have at least 1 or 2 people who are regularly visiting, and we would have people in that situation, then it would take a creative effort to find a professional, but that would be an option.
So not really something like that you draw up legal papers for, just say this person is my advocate,
The legal papers would be the court-appointed guardian and custodian. If there is nobody, the courts will step in and they will appoint a professional guardian and custodian. But that's going to take a court order. Let me give you, I've got it in front of me here. I told you that list that's circulating, please sign it. It will get you on the National Retiree Legislative Network mailing list. You'll get their newsletter, read it. If you see something that really gets you upset, call me. But keep an eye on legislation that impacts all of us, okay? I told you about the SHINE program. It's a group of trained volunteers who will give you objective advice. Question? Yes, it's 1-800-262-2243. Let me repeat that. It's the SHINE program, 800-262-2243. I talk to people all the time. I talk to people one-on-one. I'm willing to, if you call me, I will talk to you. But SHINE is good. They can drill down on the intricacies of Advantage plans. They can give you a comparative analysis. But make sure when you talk to that SHINE person, you kind of remember what we talked about today so that you can show that person that you're not thinking in an isolation here. I'd like to talk to you about, in the next few minutes, you'll find out quickly that my brain is fairly dysfunctional, and I'm involved in a lot of different things. But one of the things that I want you to know about, and again, it's unrelated from Medicare, but it's important to us in our community. Did you know that United States military veterans that are in financial need don't have access to dental services unless they're 100% disabled or were prisoners of war? I'm on the board of directors of Langley Health Services, which is a nonprofit community health center, federally qualified community health center, and they provide medical, dental, and psychiatric care to low-income folks here in Central Florida at a half a dozen different locations throughout the community. We put together a fund with a number of nonprofits, including the couple Rotary clubs, including the Rotary Club we're involved in. We created this fund. We are leveraging the sliding scale that Langley can provide to low-income folks. But when that low-income person is a veteran, we reduce that sliding scale even further to a $5 copay for general dentistry, and we pay $800 toward the set of that veterans' dentures. We've served in excess of 500 people here in Central Florida, including 25 or so sets of dentures. It's a big deal. It's a big deal. We're very proud of it. Our Rotary Club's very proud of it. Langley Health Services, if you don't know about Langley, in this environment, as we sit here in a church environment, we need to know about it. They will provide medical, dental, and psychiatric care to people without resources, without insurance, without regard to their ability to pay. And that's a pretty big deal. Every one of us sitting here, right, we're talking about the nuanced difference between a PPO and a Medicare supplement. The bottom line is we all got great insurance sitting here, regardless of the plan we have, whether you've got an HMO, a PPO, or a supplement. We have great coverage. Not the case with a lot of people, and particularly those under 65. So we've also put together a program to provide radiology services to mostly women in the Wildwood area that don't have funds for the MRI or the CAT scan, that radiology. We're providing it through Langley. We provide those services subsidized by a fund that our Rotary Club created. I told you about organizing your life in a 6-inch thick 3-ring binder. Please take that seriously. Please go to my blog that's on the top of the sheet that you were given. Download my Plan for Life checklist. Look at the table of contents on what goes into that binder and take it seriously. I can tell you the horror stories that have occurred over the years because people couldn't find the documents. One story I got to tell, it's a dear friend of ours had all the documents written. It was not a long-term marriage. It was but all the documents were done, the lawyer had done them. But he didn't quite trust her. So he pulled out the medical directives and the durable power of attorney out of the binder, and when he had a massive stroke, couldn't speak, she couldn't find she went to the lawyer, and the lawyer said, yeah, we did those documents, but all I have is a copy. Copies don't count. On the Friday, they were going into court on a Monday to get a guardian and conservator appointed. He lived for 15 years before he recently passed. They were going to get a guardian and conservator appointed to manage a fairly significant estate. She would have been the guardian and conservator, reporting to the court. On Friday, before that Monday, she's out in the workshop, under a bunch of stuff. She pulls out a file, and there's the original documents signed that she used for the 15 years before he passed. If that isn't a lesson for every single one of us, to not only have them done, but to know doggone well where they are. And they must be in that binder, and they must be in that safe. That sends shivers up my spine when I even tell the story, and it's a true story. I talk about medical records, and medical records. If you were in the emergency room today, unconscious, and the doctor asked you what drugs you were on, you're unconscious, you've just had a stroke, would you be able to tell the doctor if you're on what drugs you're taking and if you're on a blood thinner? You couldn't? That's the dilemma. And here's why it's a dilemma. If you have a stroke and you go to an emergency room, the first question they want to know is, are you on a blood thinner? Are you on Eliquis? Why do they want to know that? Because there's a clot-busting drug they can give you. Again, I'm not a doctor here and don't even pretend to be one. But it's my understanding they have to give you that clot-busting drug within 2 hours. If there's any medical professionals here, you can, well, Eliquis too. Eliquis is too. It's a very short timeline that they have to give you that clot-busting drug. So they've got to know whether you're on a blood thinner. Yeah, Coumadin was the old one. Eliquis has now become the standard bearer for blood thinners. You got to know. So how do you know? Well, you got to have your drug list. Well, wait a minute. I'm unconscious in the hospital. Where are the drugs? They're right here. And I got to tell you my iWatch story before I finish the rest of the drug list story. Some of you have heard it. I don't want to bore you with it. But a buddy of mine who is a geek did a presentation to our Rotary Club on how an iWatch can save your life. Well, it's like, yeah, that's a good presentation. So afterward, my wife and I went out and bought iWatches. We figured, they tell time too, I hear. So how can we go wrong? A couple months ago, Sue and I are, shortly after we got our iWatches, we're up in the mountains on the Cherokee Indian Reservation in North Carolina, boondocking off-grid in our Airstream trailer. Nobody, I couldn't even give you an address to where we were. At 11 o'clock at night, my iWatch wakes me up and tells me to seek immediate medical care. 11 o'clock at night. We're on the Cherokee Indian Reservation in the middle of nowhere. Sue got me to the emergency room on the Cherokee Reservation. I got medical care. The doctor up there, fortunately I had a cardiologist down here. My cardiologist down here talked to him. Everything's fine. I'm still standing here. But you need to know where those drugs are. First of all, you need to buy an iWatch. It can save your life. I had another situation where I do everything at 100 miles an hour. The cleaning lady's in our house. I hear her yell, "We're leaving." So I run to the kitchen to say goodbye to her. The kitchen floor is still wet, hadn't been dried yet. I do a nose plant. I'm okay. My iWatch is automatically calling 911. I've got 20 seconds to deactivate it once it starts. It's a serious device. Let me get back to my prescription drugs. You go to the Heart app on your iPhone. You put in all your prescription drugs. They sync automatically to your iWatch. And in emergency, and I had somebody say, "Yeah, I got an iWatch. I wear it all the time except when I'm sleeping." To which I said, "Except when you're sleeping? That's the most important time to wear it." You charge your iWatch when you're watching TV with your spouse or your partner or whatever, and you charge it then, and you wear it at night. But also, see the band on here? You can go to Amazon, 14 bucks. You fill in the fields, your wife's name, your phone numbers. It says on Eliquist. It says RX prescription drugs on iWatch. It's really important that the doc knows I'm on Eliquist so that he doesn't give me the blood clot drug. If you're not on Eliquist, if you're not on a blood thinner, you need the same band on your watch, and it says not on blood thinner. Because when you show up at the emergency room, you want that drug. You want that clot-busting drug. So, I'm not selling, $14 bands on Amazon or iWatches, but get one of each. And it really is a serious thing. People don't know, what drugs are you taking? And then where is the list when you really need it? It's one thing to know what drugs you're taking and to have it written down, but when you need it and you're in an emergency, where is it? Where is that list? Well, it's tied around your arm. Well, somebody told me, I have a card in my wallet. Well, let's see. The ambulance just showed up at your house. They took you out of the bed that your spouse called, and your wallet is in your pants hanging in the closet, right? You want it strapped to your arm. I got to run through a few other things here real quick. We've got plenty of time here, actually. Knoxbox. You know what a Knoxbox is? You've seen them on businesses. Fire department sponsors a program that they put a box on the side of your house. You buy the box for $125, $150. You call the fire department. They come out and lock your house key into that Knoxbox. You don't have a key to it. Only the fire department's got it. When you call 911, they don't have to break your front door down. They can use that Knoxbox to get into your house. The Vial of Life program, you'll see some of these non-traditional law enforcement things. I've met with the police and fire department. They're ecstatic that I'm out in the public talking about these things because they're things that the fire department and police department promote. The Vial of Life, yeah, you can stuff all that stuff in a little thing like the Vial of Life, or you can get a plastic sleeve, hang it on your refrigerator, and in that plastic sleeve, put emergency information on the cover and put your medical records right there. It's easily accessible. The ambulance knows where they are. Smart 911. If I call 911, the operator is going to say, "Ooh, that's interesting. This guy's from Grand Rapids." If you go to smart911.com, download the app on your phone or Android, and fill out the open a username and password, put in as much information as you want, username or contact information, drugs, whatever. Now if you call 911, as part of the enhanced 911 system, that data automatically gravitates over to the 911 operator. They know who you are, who you really are, what your phone number is, what your spouse's phone number is, everything about you that you want to tell them is in front of that 911 operator. You got it? You're good? You're golden. It's a great program. Other programs like the SCENT program, if you got a loved one that wanders, the fire department will come out, the police department, they'll take a cloth and wipe that cloth over your loved one's body, put it into a sealed container. That sealed container, if that person wandered away, they can bring out the search dogs. The scent of that person is in that container. I had no idea that program exists. The Sumter County Sheriff is ecstatic to get out and talk publicly about these programs, and so is the fire department, and they were thrilled that I was doing the same thing. Identity theft. We can't end today until I talk about identity theft. It's all-out war, in case you haven't noticed. If you download my Plan for Life checklist, the first line of defense in identity theft is to put permanent credit freezes on each of the 3 credit files: Aspirion, TransUnion, and Equifax. And the forms, the fill-in-the-blank forms are in my Plan for Life checklist. You fill them out, you mail them to the 3 credit bureaus, you put a permanent credit freeze, they'll send you a random ID number. Don't lose that random ID number. It goes in your 3-ring binder, because if you do, nobody can get into that credit account, including yourself, unless you can produce that random ID number that they're going to send to you. So even if you don't have credit and you go to Verizon and get a new cell phone, they may want to pull a credit check on you, and you will have to unlock it. You can do it online in seconds. It doesn't cost anything. Take it off for a day or 2. It'll fall back down. They pull a credit freeze or credit check, you're golden. But the bad guy can't get in. You can spend a couple $100 a month or a year if you want for LifeLock or products like that. But I say LifeLock is trying to trip the bad guy as they're running out of the bank. A credit freeze locks the front door of the bank, so the bad guy can't get in. If you want LifeLock and the insurance that goes with it, get LifeLock. Also put a credit freeze on the credit bureaus. Credit card theft, real simple thing you can do. You're going to get your credit card stolen, guaranteed. If you haven't had it stolen already by somebody, you're probably not telling me the truth. But go to the alert section on the website for your credit card and set up an alert to get a text message for every single transaction over 0 cents. I had somebody tell me that, yeah, they do it. I said for $10. No, not $10. The bad guy goes in and charges $8.43 to see if the card works. You set it over $0. You'll get a text message for every single transaction. You'll know in real time if someone is using that card. It's a great program. Sue hates it because I can follow her around town. I can follow her around town, but you will know in real time if somebody has lifted your credit card. So what do you think if you go to the Sumter County website, there is an FBI notice on the Sumter County website that talks about the fastest growing identity theft in the United States. It's an FBI notice. What do you think it is? Nope. I'll come back and talk about debit cards. It's property theft. I really like your house. I really, really like your house. And most of these homes here, a lot of them are owned free and clear. I'm going to quit claim your home to an offshore LLC that I'm going to set up. Yeah, I got to forge your name, but that's no problem there. So I quit claim your house to my new LLC. Of course, I go out and put a mortgage on it and borrow, $500,000. And it takes 5 years to unravel this whole thing. And there's a $500,000 mortgage on the property you don't know about. That's the fastest growing theft in the United States, according to the FBI notice that's on the Sumter County website. Sumter County, and I think it's Lake County too, has a really cool program. You can go to the Sumter County website, you can click a couple things, and you register your name and phone number and email address and any deviations of your name. It's Jim Bodenner, it's James Bodenner, it's J.C. Bodenner, you know, whatever. And your spouse does the same thing. Now, if any record is recorded with the Register of Deeds in Sumter County, you get a phone call and an email from the clerk of the Sumter County, okay? Does it stop the fact? No, you just got your house, it's just quitclaim to the offshore, but at least you know about it today rather than 5 years from now. And you can quickly get in and take action to correct the problem. But yeah, who heard of this? Nobody's heard of it. But it, well, because the bank that, see you guys, the bank that borrowed the money isn't getting paid on their mortgage. They foreclose on your mortgage. What mortgage? Oh, the mortgage for $500,000 that was put on your house by the bad guy. That's how they hear about it. That's how they hear about it. So, or it's sold, yeah. Yeah, or it's sold, oh, yeah. When the new buyer, you know, with their suitcases shows up to move in. Yeah, hadn't thought of that. Good program. I've covered a lot of stuff. Are there any final, yeah, question? I do. Let me give you, first of all, if there's anybody who hasn't signed that sheet, please do. We'll get you on the National Retiree Legislative Network newsletter. If you don't have, you bet. If you don't have my handout, please make sure you get it. My blog is on there. My email address is on there. Don't hesitate to call me. I'd be glad to talk to you on one-on-one. If you want one-on-one counseling, detailed, you can always call Shrine too. Questions? Thank you for your time.